I understand that she's been a little bit less active over the better part of the last week, but we kind of didn't see her having trouble walking for the last few days. And last night was the last time that we physically saw her walking. Is that correct?
That's correct.
Okay. On her exam, from kind of the shoulders up, she looks normal. So all the nerves that go to the face, the front legs look normal. The back legs is where we have our issue. So right now on my examination, she's essentially paralyzed, so she can't move those back legs, but she can feel the toes and she can feel her tail. That's good news. That's one of our big prognostic indicators. When we look at a neurologic patient, we grade them on a scale of 1 to 5. A grade 1 is just being painful, so she would only have back pain if she were a grade 1. A grade 5 is being paralyzed, so not being able to move the legs, but also not being able to feel the toes. So she's right before a grade 5. She's a grade 4 right now. But that still means, depending on what the underlying cause is, that she could have a good shot at getting better. So in terms of underlying causes for, kind of an adult age Chihuahua mix with her history, far and away the most likely thing and the most common thing that we see is going to be a disc herniation, just like in people. Disc that lays in between the bones of the spine and normally acts as a shock absorber gets weak over time. It can herniate out and put pressure on the spinal cord, which interrupts the signals from the back feet to the brain and from the brain to the back feet to coordinate movements.
Doctor, I have a question. That happens spontaneously?
Yes, unfortunately. Our small breed dogs, Chihuahuas, Shih Tzus, Terrier mixes, all of those, are born with genetic predispositions to having weaker discs. So it can happen in any dog, but in those smaller breed dogs, we see it at a younger age, and we see it with a very sudden onset, as opposed to some other dogs, we see more of a progression.
Right, exactly.
Yeah.
That's her case.
Exactly.
And
Saturday evening, she became inappetent, couldn't jump on the couch when she tried to, and then yesterday, she stopped walking. So last night was the last time we saw her walk.
Okay. But, hopefully we find a slipped disc. That's the most fixable thing. We've got 95% chances of getting her up and walking again.
full recovery.
So I guess when I say 95% chances, I'm talking pain-free, walking on her own, pooping and peeing normally. So I guess dogs that are as affected as she is, it's tough for us to, we don't like to say full recovery. That can still happen, that dogs get 100% better, but many dogs regain the ability to walk, they're comfortable, they're walking, they walk well, but they're still a little incoordinated.
I'll do what it
Sure.
needs to be done as long as it wouldn't compromise quality.
Sure.
So to me, it gets to a point that quality is more important than quantity,
Of course.
But absolutely, the prognosis is so high, and she's gonna be able to recover her pretty much a normal function, like not stay incontinent, not stay immobilized, and not stay in agonizing chronic pain. We'll do it.
Yep. So, and that's what the MRI is going to show us is it something that we've got excellent chances of fixing and doing all of those things that you just said, her having a great quality of life and a long lifespan, or is it something more worrisome where the quality of life isn't as good and her lifespan isn't as long? So that's where those tests come in.
Chiki was rescued from the streets when she was about 7-8 months.
Okay.
So yeah, she's 7.5 years old right now.
So you rescued her as a...
We found her on the streets, yes.
Okay. Well, she's lucky to have found you, so...
Yes,
this
thank you
afternoon,
for
okay?
everything. Take care of my baby.
That's what
I
you
know
do.
you guys will.
All right.
Thanks for watching. If you enjoyed this, please give us a like or a subscribe. It'll really help us reach more people and help more pets. Thanks so much.